Thank you all. How's everybody doing this morning? Good. Oh, so? Okay. I hadn't seen that before, but okay. Well, maybe after this you'll be doing better. All right, so what we're going to talk about today, obviously, is physical activity in men. Okay, so we're going to talk a lot specifically about men rather than just talking about physical activity in general. We're going to go over a couple of things. We're going to talk about physical activity. We're going to define what physical activity is. We're going to talk about why it's important. We're going to talk about the importance for men specifically. We're going to talk about the current physical activity recommendations, and then we're going to spend some time going through research studies that have looked at a specific kind of physical activity training and its effect on men. Okay, so it's a very kind of specific area that we're going to look at. So I want your definition of physical activity. What does physical activity mean to you guys? Exercise, movement, moving, working up a sweat. What else? Getting your heart rate up. I'm sorry, say again?
Heart rate and blood flow.
All right, so getting your heart rate up, getting the blood flowing. Any other difference?
Cardio.
Okay, so yeah, so cardio exercise, things that work the cardiovascular system, right? Okay, so I'm going to show you guys some pictures. And what I want you guys to do is to kind of tell me if this is what you would define as physical activity or not, okay? All right. Nobody thinks that's physical activity? You sure? It's you. Okay. All right, even though he's got his remote in his hand, he's not doing physical activity. Yeah, just the thumb activity, okay. What about this one? No, he's got two arms up though. You sure? It's not physical activity. That's true, he does, and he does have to swallow that beer. Okay. Yep. That's well, for many people it's a whole lot of seasons. It's football season, it's baseball season, it's
Sometimes I'll jump up.
okay, to scream and shout. Oh, I understand. For the Gators? You didn't catch that one? Okay. What about this? Is that physical activity? Okay, so why is that considered physical activity? So why is this considered physical activity? Okay, he's weightlifting. Yeah, so that's actually Michael Strahan lifting Kelly Ripa. Yeah, so okay, so you might consider that physical activity because he's using his arm muscles, right? He's gonna, do a couple of bench presses with it, right? Okay. What about this? No. So you guys right now are not engaging in physical activity? Okay.
Moving our toes.
Moving. What about this? Okay. Why? Okay. He's using those muscles. That's right. What about this? So no, that's not physical activity? Standing? Okay. So, not much. Okay, that's probably accurate. It's more than what you're doing when you're sitting down because you got to use muscles to stabilize the body, but it's not much physical activity. What about this one? So this is definitely physical activity, right? Okay.
Hasn't there been a lot of talk lately about sitting being a whole lot worse than standing, and they recommend that even if you're just standing still, you're better off standing than sitting?
Yes. So essentially, when you sit, in general, your body is sending signals to the opposite of health. So it's sending signals to increase your insulin and glucose and those sorts of things. So yes, there's a lot of research that's going on about sitting, and we have an investigator here who is doing a lot of research on sitting. And so yes, sitting, and especially extended periods of time of sitting, like sitting through my talk for 45 minutes, is worse than if you were to sit and then stand up after like 10 minutes and then sit back down and, that sort of thing. So extended periods of time of sitting are not very good for you at all. Yeah. Okay. So we have actual definitions of physical activity here, okay? So physical activity is actually defined as bodily movement that's produced by skeletal muscles that requires energy expenditure, okay? So by me standing up here and using my muscles to kind of move around, that would be considered physical activity, okay? Walking, running, dancing, that sort of thing. Exercise is a specific kind of physical activity that's more structured, okay? It's planned, it's purposeful, It's when you go to the gym. It's when you go for a 30-minute run. Those sorts of things. That would be considered exercise, okay? And a lot of people kind of interchange those terms. What we're going to talk about in general through the first part of the talk is physical activity. And then for the rest of the talk, when we talk about the scientific aspects, we're going to talk about exercise specifically, okay? So planned, structured activities. And let me just say this too. If you guys have questions at any point in time, feel free to ask. You don't have to wait till the end of the talk to ask. If you have a question that pops up, just raise your hand. Why? You're sitting because it's conventional. If you would like to stand, feel free to stand at any point in time during the talk.
Back to that slide for a second.
Which one? Okay.
Are you saying that walking, running, swimming, you don't define it as exercise?
If you were walking, if it was a planned walk, like you said, I'm going to go and I'm going to walk for an hour around my neighborhood, that would be considered exercise. If I'm walking from here to the bathroom, that's just physical activity. So, and you also have to remember that exercise, you're exercising with an intensity comes into play. So when you're exercising and you're taking a walk, you're not normally walking at your normal pace. You're walking a little bit faster because you're trying to get to that moderate intensity level of physical activity. So if you were taking a planned walk that was higher, at a faster pace than what you normally would, then yes, we would consider that exercise. But if you're just walking around in general, like you walking from this talk to the, downstairs to go to the recruiting department and then back upstairs to go to the regular talk and then out to your car, that's just considered walking. It's physical activity, but it's not exercise. Is that clear? Okay, so if I were to ask you guys, if you were exercising, 150 minutes a week of exercise, how many of you guys meet that criteria? So 1, 2, great, keep your hands up. 150 minutes a week, yeah.
I do water aerobics, is that exercise?
It is? How often do you do it?
3 times a week,
For how long?
an hour each time.
So yes, you would actually meet that criteria because that'd be 180 minutes.
I don't think I sweat.
You don't think you can what?
I don't sweat in water, don't I?
Oh, well, you do. You're not noticing it because it's being washed off. So, okay, I'm sorry. Those guys who are doing 150 minutes a week, raise your hand again. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. It's 15 and there's 16. And there's probably 40 of you guys in here. All right, so maybe a little bit less than half, okay? So when we ask the general population, of men, how much physical activity do you get? Most of them say that they get, half of them say that they meet the criteria for physical activity, okay? So, and that's that blue column that's right there. If we put devices on people, okay, devices called an accelerometer, which measures essentially your physical activity or your force as you move through the world, or we put pedometers on people, your physical activity levels come down quite a bit, okay? So if we just calculate all the activity that men do in a day, so some of them with objective measures will get that criteria. So it could range anywhere from 8 to 37 minutes, okay? But if we analyze it in terms of bouts, because we want you to do exercise in at least 10-minute bouts, okay? So when we put that criteria on it, you get about 10% of the men who are actually doing the recommended amount of physical activity, okay? So self-report is much different than objective measures. And so what that really tells us is that men are not as active as what they think they are. The good news is nobody is. Women aren't as active as they think they are either, okay? So we're really not very active in our society right now. So why is physical activity important? Like why do we care about physical activity? For a number of reasons. One of them is because of the mental health benefits that you get, okay? So we know that physical activity is associated with lower levels of depression, lower levels of anxiety, higher levels of quality of life, and overall just improved mood, okay? So people who do more physical activity or report doing more physical activity also report being in a better mood, okay? Why is it also important? Because it's related to chronic disease, okay? So people who report more physical activity, or men who report more physical activity, report lower levels of obesity, okay? They report lower levels of cardiovascular disease, diabetes, certain kinds of cancers, okay? Strokes also, all right? So it's good for your mental health and it's also good for your physical health, okay? So these are just epidemiological studies. Essentially, we've given out questionnaires to people and we've asked them how much physical activity they do, and we also look at their health, okay? Their objective levels of health. And these are the correlations that we find. What we're going to do in a little bit is we're going to talk about actual studies where we're having people exercise, and then we're seeing what the effect is on their health. All right, so as an example of some of the benefits of being in shape, so fitness is highly related to cardiovascular disease, okay? And so your fitness levels, or when we put people on a treadmill and see how much oxygen their body can deliver throughout the system, these are actually coded a little bit incorrectly here, but this is low levels of activity. These are medium and represented in the light blue, and then yellow is high levels of physical activity. And here is your death rates on the y-axis. So as you can see, your death rates go down as you do more physical activity for both women and dramatically so for men, okay? So more physical activity, then you have lower levels of cardiovascular death from cardiovascular disease. Then this is a study that was, so the study that I just showed you was in primarily white men or white Americans, and this study is done in all African Americans. And so what we have here is the metabolic syndrome, which essentially is, it's a syndrome where you have high levels of insulin, but there's really there's 5 different categories. So it could be looking at high weight, your waist circumference, looking at your glucose levels, hypertension, and your triglyceride levels. So when we look at this, here we see the metabolic syndrome, and we see that, and down here is your steps per day, okay? So if you're taking 25 to 49.99 steps per day, 5,000 to about 7,500 steps a day, and then greater than 7,500 steps a day, in comparison to taking fewer than 2,500 steps a day, what you see is that your odds or your risk of having the metabolic syndrome or the high glucose levels decreases, okay? So here, by taking between 2,500 and 5,000 steps a day, your risk drops about 35%. And here, in these 2 bars, by taking even more steps, you have even greater reductions. You're reducing your risk even more of having the metabolic syndrome and high levels of glucose, okay? So more physical activity, objectively measured, the better your health benefits. All right, so why is it important for men? So men in comparison to women. So the percentages on the left are men, and the percentages on the right are women. And so we see that that men actually have higher rates of overweight than do women, okay? So overweight being a BMI above 25. And BMI really is just a measure of, it's a ratio of your height to your weight, okay? And BMI really looks at your risk for disease. So above a BMI 25, then you have increased risk for disease, and then a BMI above 30, which would be considered obese, you have even higher risk for disease. So in terms of being obese, we see that men and women are about the same. In terms of heart disease prevalence, though, men have a higher rate of heart disease prevalence. Diabetes is about the same, and then 2.3% of all men have prostate cancer. And why I put these up here is because physical activity is a modifiable risk factor for all of these conditions, meaning that the more physical activity that you do, you reduce your risk of developing all of these diseases, okay? So, and then if we look specifically at ethnic minority men, basically do the same findings apply. And so here, the way that it's listed is whoever has the highest percentage is actually listed to the left, who's in the middle has the middle, and then the lowest level of percentage would be on the right. So as you see here with overweight, Hispanic men have the highest rates of overweight. In terms of obesity, Hispanic men have the highest rates of obesity, so a BMI greater than 30, and then a BMI greater than 40, black men actually have the higher rates. So when you get to your extreme levels of obesity, African American men have higher rates. And then in terms of cardiovascular disease, you see that African American men have higher rates of most of the cardiovascular disease, except for coronary heart disease, where white men actually have higher rates. And then black men have higher rates of stroke and diabetes. Okay, so we see here from this graph that ethnic minority men actually have a greater risk of developing these chronic diseases than do white men. So physical activity, again, being a modifiable risk factor for these conditions. We'll go through a couple of charts here. Looking at cardiovascular disease, we see that in terms of black men and women, that cardiovascular disease is a major cause of death for both African American men and women, okay? Followed by, I think this is accidents, and then diabetes and some other conditions down here. So cardiovascular disease being very significant. Here, the graph, we're looking at it in terms of gender and ethnicity. So we have white men and women here, black men and women here, and Hispanic men and women here, looking at the rates of high blood pressure. And so as you can see that African Americans have higher rates of hypertension across different years of assessment compared to both Hispanic and white men and women. If we look at physician-diagnosed diabetes, so what this means is that your doctors actually told you that you have diabetes. This does not account for the men who have diabetes and don't know it. Okay, that's another large percentage of our population. Okay, so just physician-diagnosed diabetes. Again, we have ethnicity by gender. So we have males over here, females here. We have white, African-American, and Mexican-American men here, and then the same for women over here. And as you can see, that African-Americans have the highest rates of diabetes, followed by Mexican-Americans, and white men and women having lower levels of diabetes. So again, some ethnic differences. In terms of first stroke, your first incidence of having a stroke, we see that African-American men here, again, it's color-coded, but this green line here would be African-American men who have higher rates from 45 to 65, and then after that point in time, then white men tend to have a higher first incidence of stroke. But in terms of stroke death, we see that actually African-American men here have the highest rates of death from stroke, okay? So basically what we just went through to show was that there's some ethnic differences in some chronic diseases. Chronic diseases are prevalent, so even though African Americans and Hispanics tend to have higher levels of these diseases, all men are affected by these chronic diseases. And exercise can be one of the things that helps to reduce your risk of developing these disorders. Cardiovascular disease is not only prevalent, but it costs our government, our country, a lot of money. So $315 billion a year in direct and indirect cost for treating cardiovascular disease. And if we were to do the same thing for diabetes or stroke or any, well, not stroke because it's on here, but diabetes or cancer or any of those other disorders, we'd see that the cost is very high also. We'll go past that one. So current physical activity guidelines. What does our government currently recommend that we do in terms of physical activity? Anybody know the recommendation? 30 minutes a day. What did you say?
10,000 steps a day.
10,000 steps. I think that is something that is a recommendation, but I'm not sure that our government actually recommends that. But that is a very popular kind of goal that people have. So the Surgeon General, I'll have to check on that, but I'll take your word for it. 30 minutes a day. Anybody else?
3 times a week. 3 times a week.
3 times a week of what?
30 minutes a day. 30 minutes a day.
Okay, so that would be 90 minutes a week. Any other recommendations? Any other thoughts? Okay, so what our government actually recommends is, first of all, that you avoid inactivity, okay? So avoid doing what you're doing right now for extended periods of time, okay? So, and actually, again, the extended periods of time of sitting are what's worse for you rather than breaking it up, okay? So if you find that you're sedentary for a long period of time, taking time every 15, 30, every hour to kind of break up that sedentary time is good for you. All right, so your government actually recommends that we do 150 minutes of aerobic exercise, okay? 150 minutes of aerobic exercise, or you can do at moderate intensity, or you can do 75 minutes of vigorous intensity, okay? So moderate intensity versus vigorous intensity, how do you tell? So essentially, moderate intensity is going to get your heart rate up. It's going to be at a pace where, you know, you can talk, but you can't sing. Those are kind of common sort of guidelines for moderate intensity physical activity. Vigorous is going to be much more intense than that, okay? So you wouldn't be able to sing. It would be a very hard work for you to do. So if you were walking at, say, 3 to 4 miles an hour, that, whatever is equivalent to you doing that would be considered moderate intensity physical activity. And if you're going faster than that, which means you're probably going at a jogging pace, then you're getting into vigorous levels of physical activity, okay? So it's actually 150 minutes of aerobic activity at moderate intensity, okay? So, but your government also recommends that you do strength training 2 days out of the week, okay? So what do we mean by strength training? What is that? Lifting weights, okay?
But you don't have to lift heavy weights, you just do lower weights at more reps.
You can, yes, that's true.
That way you won't hurt yourself.
Right, so you reduce your risk of injury with proper form and by lowering the weight. But yes, the government wants you to do 2 days a week of muscle strengthening activities. Can anybody tell me why? Why previously did the government only recommend that we do aerobic, and now they're recommending that we do both aerobic and strength training?
Muscles deteriorate after time if you don't use it.
That's true. They do. They tend to go away with age. That's very true. What other reasons might there be? To burn fat, potentially. Any other thoughts?
The muscle weighs more than fat. So the more muscle you got, the less fat.
Maybe. That's not necessarily certain. Yeah, you do have to eat right. Flexibility, that's another kind of exercise though. So if you're doing stretching, that's flexibility. But by doing strength training, you're not necessarily increasing your flexibility.
Making love count?
You know, there's a compendium of physical activities where they list like all the energy expenditure for physical activity. And so, yes, that's there, but it's not strength training. Okay, so the reason why they recommend strength training is because you get additive effects by doing both strength training and aerobic training together, okay? So what you can get, for the most part, not completely, but what you can get from strength training or aerobic alone, if you combine the two, you'll get better benefits in terms of some of the health outcomes. And we're going to talk about some of those health outcomes, okay? So that's why it's recommended that you do both strength training and aerobic training. Okay, we're going to go through a couple of studies that have looked at both aerobic and strength training, but be warned that exercise is good for your health and it's good for your mind, okay? So both your physical and your mental health. All right, so we're going to go through these studies real quick. If you guys have any questions about them, feel free to ask. All right, there's going to be a particular format to all of these. They're all going to be a combination of aerobic plus strength training, all these studies that we're going to talk about, okay? So the men in these studies did a combination, or at least one group of many did the combination. It was all supervised, which means that somebody was there with these men to actually watch all the physical activity that they did. So when they were on the treadmill, somebody was right there next to them on the treadmill, making sure that their heart rate was where it was supposed to be, or at least they were checking on them every 5 minutes, okay? When they were doing strength training, somebody was there to watch them do every repetition, make sure that they were doing the proper weight. So these were very rigid, structured exercise training programs, okay? And we're going to see what the benefits are of them. Now, these are not necessarily real world, okay? So how many of you can afford to have somebody, a personal trainer with you every single time that you exercise? Anybody? No? Okay. Well, that's why it's not real world, because most people can't do that. So this first study looked at adiposity, middle-aged men who were pre-hypertensive, so they were not hypertensive. They didn't have hypertension, but they weren't normal blood pressure either. They were sort of in the middle, okay? They exercised for 3 days out of the week for 6 months. It was supervised again. It was aerobic plus resistance training, and there was 53 men who were in the study. And so they had two groups of men who were in the study. They had those who were with and without type 2 diabetes. And those who did not have type 2 diabetes are right here. Those who did have type 2 diabetes are right here. And so what you see is that you have decreases in your subcutaneous adipose tissue. That means that fat that's right underneath your skin, okay? So they had a decrease in that fat. Then they had visceral adipose tissue decreases too, okay? So the visceral adipose tissue is that fat that's around your organs, okay? So they saw a significant reduction for visceral adipose tissue for those men who were without diabetes, and you saw a small reduction for those who had type 2 diabetes. Weight went down just a little bit, and fitness actually went up, okay? And remember, fitness is important because lower your levels of fitness, we saw in that graph that the higher levels of death from cardiovascular disease, okay? So fitness is very important. So in this study, you see the benefits of doing both, okay? So you decrease your adipose tissue, and you decrease your weight a little bit, and your fitness goes up, okay? So here's another study. They were really looking at lipids, okay? So that's stuff that kind of clogs your heart. They had young men who were in the study. They were borderline, having high LDL, which is the bad cholesterol. They exercised for 3 days a week for about 4 months. It was supervised again. They did 22 minutes of aerobic and then 2 sets of 15 repetitions for the strength training, okay? So that kind of tells you what kind of strength training that they're doing, okay? It's 15 repetitions, which is a lot of repetitions, only 2 sets, and they're doing about 60% of their 1 repetition max. So whatever they could do maximally for 1 repetition, they took 60% of that value and started them off and trained them in. There's 38 men in this study. So what you see here in terms of the LDL is that it went down 1.6 millimoles per liter. To put that in, to make it make sense, they were borderline having high LDL levels here because it was at 4.3 at the beginning, and then it dropped to a level that was almost normal after the end of the study, okay? So these were the men who were in the combination treatment. You see that it also went down in the aerobic training, but it went down a little bit more in the combination training. It didn't change at all in those men who were, well, it went up a little bit in those men who did not exercise, okay? So your lipid levels come down. They saw a decrease in body fat. They saw an increase in fitness. There was no change in body mass in this study. But the important factor is that by doing the combination training, they actually decreased their lipid levels, okay? And obviously lipid levels, high lipid levels can lead to atherosclerosis, which can lead to heart diseases and strokes. All right, another study in hypertensive men, okay? So these were older men. They were pre-hypertensive again, not meeting the criteria for hypertension, but they were pre-hypertensive. Again, 3 days out of the week, it was supervised aerobic plus resistance training, 25 men. So what happened was you see that both the diastolic and systolic blood pressure came down with the study, okay? BMI didn't really change, but they had a decrease in body fat and an increase in lean mass, okay, which is what you want. You want your lean mass to go up or at least stay the same. You don't want to lose lean muscle tissue, okay? So these men had benefits by being in the study. If you just look at overall kind of general effects, in younger men who did 5 days out of the week, supervised exercise, their training was a little bit more intense. I'm sorry. So if you look here, you see that their heart rate gets to 65% to 80% of the heart rate reserve, which goes from moderate intensity into vigorous level of intensity. Their resistance training sets, they did 3 sets, which was more than what the other groups were doing. They were doing 6 to 10 repetitions, was a little bit fewer, so they were doing heavier weight. And they were doing 75 to 80% of the 1 repetition max. So they were doing a more intense exercise than the ones that I showed you before, probably because they were younger men. And so what you see here is that their body weight went up a little bit, but that was related a lot to their lean mass. So they gained a good deal of lean mass tissue, okay? And their body fat mass went down, which is good. Again, you want lean mass to go up and body fat to go down. Their fitness went up just a little bit, okay? These are the men who are in the combination group, okay? So here in the graph, you can see there's the aerobic group, the resistance training group, and the combination group. So their body weight didn't go up as much as the resistance training group, but still it went up because of the lean mass. Their body fat went down as much as the aerobic group. Their lean mass went up just as much as the resistance training group, okay? And their fitness didn't go up as much as those who were doing strictly aerobic, but it still went up significantly, okay? So you're seeing all these benefits by doing the combination training. Yes?
Going back to the reps,
Mm-hmm.
what's more important for you? More reps and less weight or resistance, or higher resistance and fewer reps? I've never been able to get an answer for that.
Yeah, so in terms of health benefits, they haven't really done studies to really show which one is going to be better for you. But if you look at these studies, no matter which way you do it, you get health benefits. So these men were doing lower repetitions and heavier weight. The previous studies that I showed you, they were doing lighter weight but more repetitions, okay? And you're still getting health benefits, okay? So in terms of health, they have never really done a definitive study to show which one is better for you that I know of. But by doing any combination, you're doing fine. Just in general, typically guys who are trying to bulk up tend to do lower repetitions with higher weight, and people who are trying to lean out do higher repetitions of lower weight, just as a general principle. But doesn't always necessarily lead to massive weight gain and things of that nature. So again, general effects, you can see that the combination group had very good benefits. Okay, so in terms of sugar or insulin, glucose levels, middle-aged men, 5 days a week, they did it for 12 weeks, supervised exercise, aerobic plus training again. 47 men who were in the study, 13 who were doing the aerobic plus the resistance. So what you see here again, body mass is going down, okay? Fat-free mass is going up, fat mass is going down, total body fat is going down. And both the subcutaneous, so under your skin, and the visceral, which is around your organs, are both going down significantly, okay, by doing the combination treatment. And fitness is going up 38%, okay? So that's pretty large gain in aerobic fitness by doing a combination treatment. And then here, in terms of the insulin and glucose, the glucose went down, not significantly, but it did go down in the combination group. And then in terms of the insulin went down significantly, which is important. You want your insulin to go down. You don't want a lot of insulin circulating in the body. And then in terms of inflammatory markers, they went down significantly as well. So again, with a combination treatment, what you're seeing is decrease in body fat, increase in lean mass. Now, let's talk about the stress, okay, in terms of stress. These were men who have prostate cancer, okay, so admittedly they're a little bit stressed. They're exercising 5 days out of the week for 12 weeks, supervised again. They're doing moderate to vigorous physical activity, and they're doing repetitions that are going from high repetitions to low repetitions over the course of the study. It's 57 men, 29 who are in the aerobic plus resistance. What you're seeing is lean mass goes up, not surprisingly. The quality of life improvements in general health, vitality, and physical health composite, okay? So we're seeing that they're feeling more energized. They feel that their overall health is better, and in terms of their physical functioning, they feel better, okay? But I use this as an example that physical activity doesn't solve all your problems, okay? So here, there was no change in fat mass. Their PSA didn't change. The glucose didn't change. Neither did their insulin, okay? But, and they had 7 of 10 scales on the quality of life that didn't change, okay? So these were the 3 that did, but there were 7 of 10 that didn't change. So although physical activity is good for you, we can't guarantee that just because you do physical activity that you're going to receive all these benefits. But more than likely you will. Again, there are some mental health benefits by engaging in regular physical activity. Okay, so just a little quote here. This is probably true. The food is the most abused anxiety drug, and exercise is the most underutilized antidepressant. Okay, so again, exercise is good not just for your physical health, but for your mental health. Okay, so now I'm going to talk a little bit about studies that have been done here specifically at Pennington. I'm going to talk about one that's completed, one that just got done, and one that's going on right now. Okay, but before we get into that, I want to tell you that here at the Pennington Center, we're pretty good at what we do. So when we do exercise studies, we generally have everybody, come in, they get more physically active, they enjoy our studies, okay? Many of the men will come in looking like this, okay? Clearly out of shape, in use of an exercise program. And typically what happens after the exercise program is that they look like this, okay? So anybody, interested in getting involved in studies at Pennington, you can expect to have some good benefits. All right, so we're going to talk about Heart D, which was a study that was done here a couple years ago by Tim Church. And he was looking at essentially the health benefits of, he was comparing aerobic resistance and the combination treatment in diabetics, okay? So he had 262 participants in the study. They were sedentary with diabetes, so their levels were to qualify for diabetes, but weren't so high that they were out of control. There was a control group that did stretching. There was an aerobic training group, a resistance training group, and a combination group for 9 months, okay? The primary outcome variable was the hemoglobin A1C, which is essentially how much sugar your red blood cells are maintaining, how much sugar is in your blood over the previous 3 months. And some of the secondary outcomes are fitness and strength and body fat mass, which is what we saw in some of the other studies. Okay, so the combination group actually had very good retention at 82%, whereas the aerobic group didn't. They didn't have as good retention. So if you're just doing aerobic training, you tend not to have people come in as much, at least from Tim's study. So this graph here really demonstrates that what people did over the course of the study. So they ended up lifting more and more weight as the study went on. Okay, so they were training their muscles. Okay, and there were both men and women in this group. And this graph really shows that in terms of the aerobic training and the combination training, there were many similarities. So they attended the same number of group sessions, about 3. The intensity was about the same in terms of their fitness. They were at 60% of their VO2 peak. The speed on the treadmill was about the same. The grade on the treadmill was about the same over the course of the study. So was the energy expenditure, and then the time that they spent on the actual treadmill was about the same. So about 110 minutes a week on the treadmill. Total time exercising for all the groups was about the same. It was about 140 minutes. If you take all the time, the warm-up, the cool-down, all the resistance training that the men did in combination with the aerobic, it was about 140 minutes a week, which is just shy of our recommendation of 150 minutes, our government's recommendation. So what kind of effects did he have? In terms of the HbA1c, the hemoglobin A1c, your control group, it went up, okay, as you would expect. If you're diabetic and you're just in a control group, you're not doing anything, then your levels are likely to go up a little bit. And the combination group is right here, and as what you can, is right here. And as what you can see is that it went down and it kind of stayed down. In this combination group, this decrease was greater than the control group, okay? Whereas the resistance and the aerobic alone, the changes were not different from the control group, okay? So again, hemoglobin A1c improves. In terms of strength testing, The combination group didn't have as great changes as the resistance group, but they did have significant changes compared to the aerobic and the control group, okay? So their strength improved, all right, which is what you want. Waist circumference. All three of the groups had significant changes in waist circumference, okay? So your combination group, they had greater changes than the control group. So waist circumference coming down, which is good because that's one of the criteria for the metabolic syndrome that we talked about earlier. Weight. The combination group had significant changes compared to the control group and the resistance training group, okay? So weight coming down with the combination of aerobic plus resistance training. In terms of the DEXA, in terms of your body fat, what this really shows is that the combination group here, they were able to maintain lean body tissue, okay? Whereas they dropped fat mass, okay? So their fat mass, subcutaneous and visceral, came down and their lean mass went up. So now they've been able to maintain their lean muscle, which is what you need, whereas the aerobic group, they kind of decreased their fat mass, but they had an increase in their, the resistance training had an increase in their lean tissue, but the aerobic group had a decrease in their lean tissue, okay, which is what you typically see. So if you just do aerobic, you tend to lose your lean mass, but by doing a combination, you maintain that lean mass, okay? So now you still have that lean mass to engage in that aerobic activity, and that's getting stronger, okay? So this is what you want to have happen in a study. And so these are just more of the outcomes, but essentially, by doing the combination, you have greater changes to your hemoglobin A1C, your fitness goes up, your muscle mass is maintained, and your fat mass goes down, okay? And these are the kinds of things that you want to see. And the amount of exercise, amount of time, again, was the same across all groups, okay? So there's another study that was going on here at Pennington that just finished. So we don't have results to present, but I just wanted to show you the kinds of things that we're doing. This was a study done by Dr. Martin and Dr. Church, and it's called eMechanic. And the purpose really is to see what happens with your eating and your energy expenditure as you exercise, okay? So that a healthy living group, a recommended dose exercise group, and a high dose exercise on energy balance. So how does your dietary habits change? How do they change in combination with your physical activity habits, okay? So this is just sort of typical of what happens at Pennington. You come in for some run-ins, you have a clinic visit, baseline visit, then you have your intervention, and then you have your assessments at the beginning and the end of your intervention, okay? So some of the assessments that he did, he looked at the accelerometer. Remember that device that I talked about where when you put it on men, it shows that we really don't do a whole lot of physical activity? Well, he used that device to measure their physical activity and their sitting. He had a metabolic chamber, so he's measuring their metabolism through the air that they breathe. Doubly labeled water, which measures energy expenditure over the past 2 weeks. And then he did a DEXA scan, which is looking at body fat content. So just another example of a study that was done. And then what I'll leave you guys with is a study that I'm conducting right now. It's aerobic plus resistance training and insulin sensitivity in African American men. It's called the ARTIST study. The reason why we're doing the ARTIST study is that, so a lot of the studies that I showed you were primarily done in white men. Young, old, didn't matter. There was very few African American men who were in those studies, and there were even fewer Hispanic men probably who were in those studies. And so there's probably been 2 or 3 exercise training studies that have been done exclusively in African American men, okay? And they've been done really about hypertension. So all we really know is what's the effect of exercise training and hypertension. And you guys can kind of guess what happens. When you do exercise training, what happens with your blood pressure? Goes down, that's right. So what we wanted to do was we wanted to look at more than just blood pressure. We wanted to look at insulin. We wanted to look at what happens to the insulin. Does your body use insulin better by doing an exercise training program in African American men, okay? So we wanted to get men who were really at risk for developing diabetes into this study, okay? So if you have diabetes, you can't actually get into this study. And what we're looking for 104 men between the ages of 35 and 70 who are not physically active, who wide range of weights, and who have a family history of diabetes, okay? So your mother, father, brother, sister can have diabetes. Again, you go through a clinic baseline visit where we're going to measure your body fat. We're going to do a blood draw. We're going to look at EKGs. So we're going to see how your heart's functioning. We're going to give you a strength test, and we're going to give you a fitness test, okay, if you get involved. And these are kind of typical for studies that go on here at Pennington. And we're going to give you an oral glucose tolerance test, which really measures your insulin, and your insulin resistance and your glucose. Okay, so Men who get into the study will be randomized into 1 to 2 groups. Basically, a flip of a coin tells you if you're in the exercise training group or if you're in the healthy living group. And the exercise training group essentially does their exercise at the YMCA. Okay, so all those previous studies that we talked about where they were doing exercise training, they were done, at an institution. So the Heart D study was done here at Pennington, down in the fitness center. Our study is being done in the community. Okay, so we want to see if we can get them into exercise regularly at the YMCA. So we give them a YMCA membership. We let them work with a trainer once a week, and they do a combination of aerobic and strength training that matches the physical activity guidelines. Okay, so 150 minutes of aerobic activity, and then they're going to do 2 days of strength training. Okay, and the healthy living group, essentially they get information about how to live healthier. We contact them once a month, and at the end of their time in the study, we give them a 5-month membership to the YMCA. Okay, so men will come back at week 10 and week 20 to do some more assessments. So there's really about 5 visits that you have here at Pennington in terms of doing assessments, and then there's 3 that kind of come before this, before your very first assessment, so that we can get you oriented into the study. We're hypothesizing, obviously, that the aerobic plus resistance training group is going to have better benefits than just the strictly healthy living group in terms of insulin and body fat and all those other sorts of outcomes that we have. But we're also kind of hypothesizing that by doing it in the community, by doing it at YMCAs that the men can choose to go to, that we're going to have higher levels of retention as opposed to everybody coming here to do their training. Okay, so it's really a community-based type of intervention. So why would men want to participate in this study or for any study here at Pennington that we do? So it's not just specific to my study, but, well, this is specific to my study, but the YMCA. So you get a 5-month membership to the YMCA. You also get blood work done at no cost to you, okay? So your lipid levels, your insulin, your glucose, all those sorts of things we're going to do, and we give you the results at no cost to you. Then we also provide a little bit of money for the men because they have to come here for all these different visits and they have to go to the YMCA. You're contributing to science, certainly, by doing the study. And then we find that men who are involved in this study, even if they don't get any, if they're not in the exercise training group, if they're in the healthy living group, they just enjoy being in the study. They get information that's valuable to them, that helps them to live a healthier lifestyle. So this is why we want men to participate in the study. So we have 83 men in the study. We need 104, so we need 20 more men. Anybody who's interested in this study can go downstairs to the little area that's right down here. It looks out over the lake. You can talk to Emmanuel, and he can give you information about the study. Well, this testimony is not working, so I can't tell you. But any questions that you guys have? Yes?
I tried to get in the study of physical activity. You always put an age restriction.
There's many different restrictions that we have on studies. So, for example, my study is not only restrictive in terms of age, I guess, but also in terms of diabetes. You can't have diabetes to get into my study. There's age limits to all the studies, and partly we have age limits because we want to make sure that we have people who are not going to have serious events while they're in the study, because that would cause, obviously, problems for the investigators. And there are some studies that are going on that are specifically for older individuals here that are going on at Pennington right now. So if you're interested in those kinds of studies for older men, then if you go down to the recruiting booth downstairs, they'll be able to tell you specifically what studies we have for older individuals. But none of them right now are for exercise.